Hi, summer's here, and wherever you live, it is hot outside. Everybody just wants to jump into a pool, swim in a lake, go to the beach, jump in the ocean. Whatever it is, we have to remember that we need to keep our kids safe. Even though we're having fun this summer, we need to remember pool water safety. And on this episode of Ask the Doc, I'm going to answer your questions on how to keep your kids safe in the water and how to be safe for the summer.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, a show where we encourage you viewers to send in your questions so that I can answer them in real time. I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics. Let's get started with our very first question about water safety. This question is coming in from Javier. Buenos dias, Dr. Constant. My wife and I just bought a house, and for the first time in our lives, we have a pool. We also have 3 kids who are 2, 4, and 7 years old. Our new pool doesn't have a fence around it. Besides a fence, what else do we need to keep everybody safe? Well, first of all, congratulations, Javier, on your brand new home. And that's so amazing that you have a pool, because you will definitely get lots of use out of it with kids over in the house. I recommend that you get a fence to surround your pool. While it might seem like an expensive venture, it is a very, very good investment for your home. You need to have a fence in order to protect your kids, and not only to protect your kids, but to protect those that are coming to your house. Now that you have a pool, it is your responsibility to make sure others are safe, and they will, children, maybe your children can swim, but other people's children cannot swim or might fall into the pool, and also people that just might be around your house that are not as comfortable in the water. So please try to look into getting a pool fence. And another way to be safe with a pool in your home is to make sure that your kids are not outside unmonitored. Even though they can be strong swimmers, you really want to pay attention to what's going on outside and to monitor your children as long as they're near the pool. Things happen, kids play, they roughhouse, they might fall, and you want to make sure that if something does happen, you're there to witness it and to jump into the pool if necessary. So first, please look into getting a pool fence, and secondly, make sure the kids are always monitored when outside. Let's see if we have any other questions coming in. Here's a question from Facebook from Kelsey. Hi, Dr. Constant. I love the beach, but I'm scared to death of swimming far out into the ocean. I like to stay by the shoreline, but my niece and nephew are coming for a visit, and they love swimming in big bodies of water. They're so excited about coming to the beach with me, but I'm concerned that I won't be able to keep them safe. Do you have any advice? Well, Kelsey, honestly, you need to do what makes you feel comfortable. If you're going to have kids with you in the ocean, you need to stay where you feel comfortable and safe. And you need to be in an area where you feel that if something were to happen, you can actually help them. So if they like to swim out far, but you're uncomfortable and something happens, you're not going to be willing to go out there and grab them. So please stay where you feel comfortable. It's also important to note that the further out you go at the beach, the more risk you have for an undertow or an undercurrent. And that's when the water below the surface is actually pulling in an opposite direction. And a lot of swimmers that are not used to going to the beach and that are not very familiar with the ocean don't know how to get out of an undertow. So an undertow basically pulls you back into the ocean away from the shoreline. And what you need to do is, if you ever feel that you're being pulled ever so subtly, it's a very gradual pull, then you need to swim perpendicular to the pool. But that means that the person that's in the undertow needs to not only understand that they're being pulled back, they need to remain calm, and they need to figure out which direction is perpendicular and calmly swim in the perpendicular direction. So that's a big responsibility. And I think for someone that's going to have a few kids with them in the ocean, that's a lot to deal with in the ocean. So my advice to you is to stay closer to the shoreline where you have less risk of an undertow, and you have a sandbar or shallow water where you feel safe and you can monitor all of the kids and not worry about anything like that. I hope that this helps, and I hope that you and your family have a lot of fun at the beach this summer. Okay, here we go. We have another question coming in from the All Health TV app. Let's see. This question is from Janine. Hi, Dr. Constant. My partner and I had our first baby 8 months ago. And since we have a pool in our neighborhood, we're thinking about infant survival classes. So our child will be safe if she falls into the water. What do you think? Well, infant survival classes are very popular and they're a great idea, but I just want you to remember that this does not decrease the incidence of drowning. Infant survival classes, rather, are a way for you to learn pool safety and for your baby to be very familiar with the water and get used to being in the water. But I don't want you to have the false sense of security that your baby will actually survive a drowning or you can prevent a drowning by having these courses. We actually recommend swim lessons between ages of 1 and 4. Infant survival, again, less than 1 year of age, is really just going to teach your child something that we call reflex swimming. And it'll help, but it will not decrease drowning. It will not prevent drowning. And you still need to go into the water with your baby and monitor your baby. Okay, let's see who we have next. Looks like we're getting a question coming in now from Facebook. This question's from Oliver. Our son is nearly 3 years old and loves the pool. He can't swim, but he's always in the water with us. We want to start swimming lessons, but we heard that swim lessons don't really take until after a child is 4 years old. Is that correct? No, Oliver, that is not correct. We actually suggest that you enroll your child in swim lessons anywhere from ages 1 to 4. A 3-year-old could absolutely learn how to swim. And I think it's great that he's comfortable being in the pool and that he enjoys the water. So if I were you, I would take advantage now while he's comfortable and enjoys it and teach him how to swim. I think this will be great for him. This doesn't mean that you don't need follow-up lessons in years to come, but you absolutely can start now. All right, so I love these questions coming in. Everybody really wants to keep their kids safe and they want to know what they need to do to keep them safe. Let's see who else we have coming in. Here's a question from Joseph. My 15-year-old son has a best friend whose family owns a boat and they invite him to go on it nearly every weekend. They don't really go out into the ocean. They prefer lakes and smaller bodies of water. Our boy isn't really a strong swimmer. I guess our question is this: what advice do you have to help keep him safe during these boating trips? Joseph, that's a great question, especially, living down here in South Florida, where a lot of us are constantly in the water and have the opportunity to get on boats. I think the most important thing to remember is whether or not your son is a strong swimmer, any passenger on a boat needs to have a life vest. The boat, you might not necessarily have to wear it the entire time you're on the boat, but the boat needs to be equipped with the same number of life vests as there are passengers. And I don't think that you should be embarrassed or feel ashamed to ask the captain of the boat or the owner of the boat how many vests there are. Ask to see them and make sure there's a vest that fits your son. That's number one, first and foremost. And if that's not there, then I would not advise that you allow your son on the boat. With that said, in a small body of water or a lake where your son is not a strong swimmer, I absolutely suggest that he wears the life vest. And this is because he is not going to be comfortable jumping into the lake and swimming with everybody else. And remember, in fresh water, there isn't any salt, so they will sink right down to the bottom. So if you're not a strong swimmer and can't keep yourself afloat and stay above water and swim with your friends and swim back to the boat, you definitely need to have a life vest on. And also, I'd make sure that Joseph is comfortable being on the boat. If you don't feel comfortable swimming or trying to get yourself to safety, then you might not be comfortable being on a boat. So I suggest that you talk to your son about that. Okay, so we have some more questions coming in. This question is from Isabella. Hi, Dr. C. My son has been diagnosed with epilepsy recently. He loves the pool and has always been a strong swimmer. But I read that the seizure disorders can increase a child's risk of drowning. How can we help keep him safe? Well, Isabella, the seizure doesn't necessarily increase the risk of drowning, but unfortunately, being fatigued out in the sun, playing outside, might predispose your son to having a seizure. And if a seizure does occur while he's in the water, of course, you know that he could possibly drown. So my suggestion to you is, the only thing you could do with a child that has seizure disorder and is playing in the pool and going to the beach is make sure that you are always watching him, so that if God forbid he does get a seizure, you can help him right away. But a child with seizure disorder is a child that should never be left unattended in the pool. And I hope that this helps, but there's nothing else that you would need to do, but you do have to make sure that he is never unattended. Okay, so it looks like we have a couple more questions coming in. Let's see who else has a question. This question is from Lucy. Hi, Dr. Constant. My 3.5-year-old granddaughter came to visit and she used a life jacket in the pool. She called it a swim jacket and was very proud of wearing it. It seemed a little much for me. When I was raising my kids, we just put floaties or water wings on them. Are life jackets necessary for backyard pool safety? Hi, Lucy. So this is an interesting question because I know there are life jackets, life vests, floaties, they're the front vest, there are all these different devices now, and we kind of have to sift through them and make sure we understand what they are and what their purposes are. So for the young toddlers that are not strong swimmers, a lot of parents like to put these floaties on them that actually go on the arms and even across the chest. And some swim instructors have advised against that because not only, well, a couple of things. It throws the child into, it keeps the child in a perpendicular position. And so they don't know how to get into the proper swim position and they don't know how to use their swim skills to get out of a situation. They're just constantly vertical and they're unable to manage in the water. It also gives kids a false sense of security. So they believe that they can swim and that they're safe. They get used to that. So they usually do advise against it. But if you need to put wings on because your child's in the water and you don't want to carry them the whole time, or you just feel that they're safe, that's fine. There are life jackets apparently that are not approved for the boat. And some people have been putting their kids in those and letting them float in the water. Again, I think that's a preference by the parent where they feel that they might not need to carry their child the entire time, or maybe they're safer and they don't need to watch them. But I don't want those to be confused with actual life jackets that are supposed to be worn on the boat and that actually have like approval for safety on a boat. I don't think that's typically necessary, but again, it's a preference by the parent, and if they feel that their child is safer this way and that their child won't be submerged in the water, then maybe that makes them happy. But you absolutely do not need that for pool safety. As long as they have, floats on or a tube or something, a flotation device that they could hold on to and stay above water and be safe, then I think that's more than fine. I hope that this answered your question. I know that it was a little convoluted, but there are just so many options now in the water. And I think that parents get a little bit confused as to what is the best way to protect their child. So let's see if we have any other questions about pool safety. It looks like we have a question. Okay, well, here we go. Here we have a question actually about immunity and health. Sharice is asking, Doctor, my husband and I have made vitamins and supplements a part of our daily routine. We have a couple kids, so I'm wondering if there are any specific vitamins and or supplements that can help boost a child's immune system. And how do you feel about gummy vitamins for kids? Well, okay, the American Academy of Pediatrics does not strongly recommend vitamins per se. They're great and it's wonderful to give them to your kids, but it's not a requirement. The children are not deficient in vitamins where they would need to take supplements in order to replenish them. However, with that said, I will say that it has been found that fiber and omega-3 are the two components that we tend to be deficient in the American diet across the board, whether it's kids and adults. So if you want to add extra fiber to your child's diet or give a fiber supplement, that is totally recommended. And then also, if you want to give omega-3s, which is fish oil, that is really great for brain development, for ocular health, and for memory. And we strongly suggest that you incorporate that in your child's diet if you'd like to supplement. As far as immunity and boosting an immune system, There aren't vitamins that will do that. Your immune system is already developing. We received our immunity via antibodies from our parents as we were, during the birthing process and with breastfeeding, good sleep hygiene, good diet. Those are all things that will propel the immune system. So you don't necessarily need a vitamin that's going to boost the immune system. And I think there was another part of your question where you were asking, about anything that they could have at night. I think it was just a different type of vitamin. Honestly, the gummy vitamins, excuse me, I forgot about that. The gummy vitamins, those are great. However, dentists are strongly against it. The sugar content in the vitamins actually can cause cavities. And so a lot of dentists have advised to stay away from the gummy vitamins. So I used to give them to my children as well. I love them, but our dentist asked us to kindly switch to a different type of vitamin. Okay, it looks like we have another question about swim safety from Caroline. And this is a question about CPR. Let's see, Caroline. Dr. Constant, we have a 2-year-old and are expecting another child. We are considering taking infant-child CPR classes. Do you think that's necessary? Caroline, absolutely necessary. And as a matter of fact, depending on the hospital that you're delivering at, they offer the CPR classes in the hospital before you deliver. And I strongly encourage you and your partner to take those courses, and anybody else that will be considered a caregiver to your child. So anyone that's going to babysit or take care of your child for extended periods of time should absolutely take infant-child CPR classes. This is something that's important, and what people don't understand is that the CPR for an infant and a toddler is very different for the CPR protocol for an adult. So please make sure that you enroll. And I'm glad that you're asking, and I'm glad that you're being proactive. So looks like we have another question coming in. So this question is from Shanice. Hi, Dr. Constant. In a world where we have a new virus to add to the list, thanks COVID, do you have some tips that can help parents prevent the spread of infection in schools and at home? Hi, Shanice, that's a great question. It's really tough because we've lived a life for so long where we knew viruses were around, but I don't think we were terribly concerned about the spread and containing spread. And now COVID has made us almost hyper aware. It's true. I think that it's very important to teach your children. It's going to sound so basic, but honestly, we forget the importance of remembering to cover your mouth when you cough, to cover your face when you sneeze, to wash your hands before you eat. Make sure you wash with your hands with soap and water. You could use hand sanitizer, but soap and water is always a great idea. You want to make sure that if you can't hand wash, you can use the hand sanitizer, and teach your children how to do it. You want to teach your children to avoid touching their face. And really in kids, that means picking their nose or putting their fingers in their mouth or biting their nails. You want to remind them if they cough or sneeze, use a tissue. And if you can't, then use the inner part of your arm, like with your elbow. Can't tell you how many kids just sneeze into the open air and literally spit on people as they're sneezing. That should be something that's innate to any child, to cover yourself. And then lastly, the hardest thing that's so important to remember, but it's very hard to practice, is if your child is sick, keep them at home. Do not give Tylenol or Motrin or an antitussive medication and then send them on their way. Just because you contain the symptom that day does not mean you've contained the infection. So you're still sending your child to school with a communicable disease. Please keep your child at home. Regularly disinfect any surface that's been touched by your child. So a sick child, you want to wipe down the bathroom counter, wipe down their room, because now you're going to go touch everything and you will continue to spread it. So of course, at home and in school, you want all surfaces to be wiped down and clean. Finally, you want to ensure that there's proper ventilation. And again, as a parent, you really can't ensure this. You have to make sure that the school is doing this and hope that they're taking infection control very seriously. But just ask and make sure that they're properly ventilating classrooms. And at home, you want to properly ventilate the common areas where your child has been exposed. Number 8, what you want to do is, of course, vaccinate against preventable diseases. So if it's flu season, you know it's going around and you want to control the infection, make sure your child is getting their flu vaccine. Anything that is communicable and that has a vaccine, you want to vaccinate your child. That is by far going to prevent not only the severity of disease, but of course, the spread of disease. So I hope that those things are very helpful to you. You know, this summer, I know summer is about fun and getting in the pool, but viruses are also still common in the summer. We have tons of summer viruses going around, and they spread in camps and they spread in summer school. So it is important that we stay safe and that we make sure we contain the spread. Let's see if we have any other questions coming in from any of our viewers. Okay, well, Avi has a question. Hi, Avi. Hey, Doc, my boy came home today and told me that a couple of his friends at school have come down with something called gastroenteritis. I've obviously heard of it, but can you fill in the blanks, like some of the symptoms? And is it contagious? Okay, Avi, gastroenteritis is very contagious. And I'm talking within the first couple of minutes of exposure. So within the first probably few hours of exposure, a child will start to demonstrate symptoms. And the symptoms, I'll discuss the symptoms, but first let's watch this video and I'll go into the symptoms and how it spread.
A viral gastroenteritis, which we sometimes call a stomach bug or stomach flu, that's one of our more common reasons for having an acute onset of vomiting and diarrhea, and sometimes with fever. Those cases, a lot of times we're going to treat based on the patient's comfort. We really want to make sure we're paying attention to their hydration. Even with a couple hours of vomiting or diarrhea, you can get dehydrated pretty quickly. And we're going to want to make sure that we're just paying attention to how that patient's acting as well in that setting too. When it comes to fluids, when someone is having a lot of vomiting and diarrhea, you're not just losing fluids, you're losing electrolytes as well. And so actually oral rehydration solutions or therapies which are available over the counter, there are a number of brand names available that patients can ask their physicians or their pharmacists about, but those are the best options that we can offer to our patients. If you don't have that available at home, it's in the middle of the night, you can consider doing a diluted apple juice or a diluted sports drink, but we really prefer the oral rehydration solutions if possible. Most viral gastro infections will last about a day or two with the most severe symptoms up front on that timeline. If things are continuing to improve, it's probably safe to continue watching for a couple days, but after that, if you're not having resolution for symptoms, that's a good reason to go see your doctor at that time.
Okay, Avi, so to answer your question, some of the symptoms of gastroenteritis are abdominal pain, nausea, vomiting, diarrhea or loose stools, and or fever. And you don't have to have all of these symptoms in order to diagnose gastroenteritis. You might have one or two, all, or just one of them. It is very contagious. It is spread by secretions, so by saliva, or of course by the stool. And I know that sounds disgusting, but if you have a little baby and you're cleaning up after them and you're wiping them and changing their diaper and you might not have cleaned your hands as thoroughly as you thought you did, you will easily spread it. So we call that fecal oral spread, and it spreads very quickly. So as the doctor mentioned in the video, you absolutely want to make sure that you're hydrating with the component that has electrolytes. You want to hydrate and you want to control the vomiting with an anti-nausea medication such as Zofran. And if that's not available, you just take little sips and hydrate until the gastroenteritis resolves on its own. Thankfully, it usually resolves within 24 to 48 hours. Okay, so let's recap our swim safety, because again, we really wanted to make sure that we emphasize how important it is to stay safe in the water, whether it's pool, ocean, or the lake. So number one, for pools, we want to make sure that we have a pool fence, or you're going to someone's house that has properly secured their in-home pool, if this is an underground pool. So you want to make sure there's a pool fence. Children should not go into the pool unattended. Whether, despite their swimming skills, you definitely want to make sure that the children are attended when they're in the pool. Remember, even if they're a strong swimmer, they could be horsing around and playing and falling into the pool, so you want to make sure that you're there. Try to limit adults drinking around children that are in the pool. You really want to make sure that you're not drinking and watching kids, especially if other children's kids are involved. For the lake, you want to make sure that this is a strong swimmer and there's always a flotation device around, a life vest, on if you are not a strong swimmer, or even a life vest on the boat. If you're on a boat, you want to make sure that boats have enough life vests for each passenger. But in the lake, you want to make sure that you have a flotation device, because remember, you cannot float well in the lake. For the ocean, you want to make sure that you're a strong swimmer, you're staying close to the shore if you're not comfortable with strong waves undertow and deep waters. And you want to make sure that you're always paying attention to where the lifeguard says the limits are in the ocean, so that you don't pass those limits where it is a lot more dangerous. And then finally, you want to make sure that anybody that has a pool, or that has young children, toddler age or infant, you want to make sure that you're very well versed in CPR. CPR is so important, whether it's for pool and water safety or just having a child at home. You want to make sure that you take CPR lessons. Look into your local hospital to see if they offer those classes. Usually they do. I think that's very important. And then finally, we want to remember that if a child has seizure disorder, or any type of predisposition to fainting or seizing, you want to make sure that they're always attended when in any body of water. I hope that this was helpful. I hope that everybody has a happy and fun and safe summer. Don't forget your sunblock. Have a great summer.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.